Let's bring in MS Now reporter Josh Einiger, who's been following this outbreak, and Dr. Deborah Howry, who was the chief medical officer for the CDC until August of last year. Josh, interesting that they note that they're trying to have people stay a little longer than the quarantine. So give us the status update on these Americans who are still in quarantine.
So, Ariel, first of all, the good news is that none of the 18 only one of them is actually positive for hantavirus, and that person is not said to be in any kind of medical distress like the people in France. Okay. So that's the good news. They all are on like day 3 of a 42-day quarantine period. And most of them are spending that time in Nebraska at this special facility. 2 of them are in a similar facility in Georgia at Emory University in Atlanta. And there's been talk that at some point they will be allowed to return home and complete their quarantines at home, although it's not at all clear right now who makes that decision, when that gets done, how they get there, and
how long they have to stay at home after the quarantine.
Exactly.
Yeah. Okay. So the cruise ship at the center of this, the Hondias, is making its way back to the Netherlands. Is there special protocol that needs to be undertaken by authorities to make sure that cruise ship is decontaminated?
Absolutely. So there's a couple dozen crew members, by the way, who are still aboard. None of them have symptoms. None of them are positive. And so they are on the ship now, and it's supposed to dock in the Netherlands at the beginning of next week. And at that point, they're going to take them out kind of one at a time in a staggered way. They're going to start their own quarantine periods, subject to the laws of the EU and of the Netherlands. And then they're going to just systematically have to decontaminate that ship. Not clear how long that's going to take or how many takers there will be for another cruise on that ship next time there is one. But obviously, they're going to, according to all the worldwide standards, decontaminate it to the way they need to.
Josh Einiger, thank you so much for keeping an eye on all of this. You can only imagine the odyssey and the harrowing situation that all of these passengers, crew members have been through at this point. Doctor, some health experts are concerned that the CDC should be taking more measures to protect public safety. What are your thoughts on the CDC's response so far? The fact that we've got 18 people in quarantine, they're asking people to possibly quarantine longer at home.
Well, I was heartened to see that the CDC had a press conference yesterday. I hope they do that daily so that we can ask a lot of these questions directly from CDC, because I think they really need to explain the data and what they're seeing from, an epidemiological perspective. I think, today the World Health Organization mentioned that some people might be pre-symptomatic or, might have the sniffles, may not realize it's hantavirus. So I think it's really critical that those 18 people right now are really closely monitored and are under isolation. I think we need to think about what that looks like if people do go home. I think right now most would likely want to stay in Nebraska where they're close to medical care and not endangering their own family members if they were to return home.
What does the communication between the CDC and the WHO look like, given that the U.S. has withdrawn from the World Health Organization? And is that concerning?
So the communication to date, because it's an emergency, CDC has been able to communicate with the World Health Organization. But, as an ER doc, I always say it's best not to be communicating with somebody for the first time in an emergency. You want to really have those established communication channels before that. I also would have liked to have seen CDC really a lot more upfront, but because we had withdrawn from the World Health Organization, the WHO has actually done a spectacular job, I would say. They even released updated information today. I think the CDC needs to be a lot more up in front for the United States. Like California today or yesterday actually posted on their website a list of the cases that they are monitoring. I think we should do that with a national dashboard just so everybody feels up to date on what the status is.
You and I have talked quite extensively about the fact that there have been significant reductions in the CDC staff. Some have voluntarily left, like yourself. What kinds of experts still remain on something like hantavirus at the CDC now?
So fortunately, there are scientific experts that still specialize in things like hantavirus. I think what you're seeing is a loss of leaders above that. Both the division director, the center director, and myself would have been supervising this hantavirus group, and we are no longer there. And so what you're seeing is at the senior leadership level, when some of these policy decisions are being made, that there's not that scientific expertise as we would hope. A lot of this is being filtered through the political channels. And I certainly hope that this time the secretary actually gets a briefing from one of the career scientists at CDC. When I was there, he never had one of those.